around the 2010 onwards, we saw the advent of these next generation or high throughput sequencing technologies. And these have developed, as you'd expect, incredibly quickly, which has led to even faster sequencing, higher capacity of sequencing, which again reduces the cost of sequencing. So in 2012, the 100,000 genomes seemed, an incredibly high ask. But then, now if we look around the world, the Emirati Genome Project looking at 1 million genomes. As we've seen the cost of sequencing come down and the technology improve, and also importantly, education around genomics and understanding of genomics and how we analyze data has really pushed that forward.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news, making headlines, and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, I'm joined by Dr. Jack Bartram, pediatric hematologist at the Great Ormond Street Hospital for Children. Our conversation today is entitled Genomic Insights, Personalized Solutions, Redefining Pediatric Cancer Care. Dr. Bartram, welcome to the podcast.
Thank you for the invitation.
You do such important and fascinating and really very special work. Can you start by giving us an overview and the significance of whole genome sequencing in the context of pediatric cancer care? How is genomics and all the associated technologies transforming how we care for kids with cancer?
Yeah, so we've really seen a revolution in genomics over the last 10 or 20 years, and the UK has been at the forefront of that. Started with the 100,000 Genome Project, which was launched in 2012. And now it's amazing to see how far we've come in those 12 years, that we have a fully integrated genomic medicine service within our healthcare service. So we are able to provide state-of-the-art sequencing technology to our patients, and we're really starting to see the benefits of that.
And how specifically does it change care in this disease area? How are patients benefiting?
Yeah, so patients are benefiting because you get an incredibly fast and accurate readout of genetic alterations within their cancer. So if we take a step back, if you look at whole genome sequencing, we all carry a 3 billion letter code, which is a genetic code, which is our genome. And what whole genome sequencing allows is an unambiguous readout of that. So you get to read every single letter of that genome. And with a cancer has a different genome to your underlying genome. And by reading out both of those, we can compare one to the other, and we can look at alterations within the cancer, which are specific to that patient. So we really are starting to reap the benefits because you get this complete unambiguous readout. So it allows you to find potential targets for new medications. It allows you to look for underlying predisposition to cancers in families. And that's one question that families always ask us is, what about my other child? Why has my child got this? So we're really trying to answer those questions. And then on a bigger scale, once you have the whole genome sequence, the ability to use that for research and to look for patterns amongst hundreds and thousands of other cancers is really going to advance our understanding of cancer biology and ultimately lead to better treatments, with the whole goal of this being better outcomes for our patients.
How has it changed diagnostics and how has it changed treatment?
Yeah, so we've looked at this very closely because, so as I said, whole genome sequencing was the initial started in 2012 in the UK with a 100,000 genome project, and that was seemed ambitious at the time. And what that really did was set up the infrastructure in the country. And then leading on from this, we've had the development of the genomic medicine service. So every patient has access to all of these technologies. And what we've done in the last year is really taken the bigger leap of using whole genome sequencing upfront in all of our patients. And I think we're probably pioneering in doing this, in that we're taking unselected patients as they come through the door, and everybody gets whole genome sequencing. There's many studies out there where you take high risk groups of patients, or you take interesting single patients. But the power of our what we've done over the last 2 years is that we're looking at unselected patients, consecutive patients, and that's really led to some key insights. which I guess the bottom line of that is, even with all the other technologies we have, whole genome sequencing in our pediatric patients it's led to a significant finding, which has changed management in about 7% of our patients, which is massive. And then if we look at other things like the additional relevant findings, we've been able to find specific targets for mutations in about 7% of our patients as well. And then equally, what we'd say a germline predisposition, so an underlying alteration in the patient's DNA, which has led to the cancer, which is an unexpected finding in just under 10%. So I think the summary is that we've changed management in nearly 7% of our patients. So it's been really, really pivotal.
It sounds like a lot of miracles, honestly. 7% of kids with cancer have a completely different course of treatment, if I understand correctly, because of the ability to use this technology. And the rest are benefiting from the way the research has changed, the diagnostics have changed, etc.
Exactly.
You mentioned the 100,000 Genome Project, which many of us outside the UK don't know about as such being a driver. But looking before it, beyond it, above it, what were the underlying drivers of moving into this realm, into incorporating whole genome sequencing into clinical practice? What was the hypothesis and how did it come about?
Around the 2010 onwards, we saw the advent of these next generation or high throughput sequencing technologies. And these have developed, as you'd expect, incredibly quickly, which has led to even faster sequencing, higher capacity of sequencing, which again reduces the cost of sequencing. So in 2012, the 100,000 genomes seemed, an incredibly high ask. But then, now if we look around the world, the Emirati Genome Project looking at 1 million genomes, as we've seen the cost of sequencing come down and the technology improve, and also importantly, education around genomics and understanding of genomics and how we analyze data has really pushed that forward. And, I feel incredibly lucky to work within our National Health Service where every patient has access to this. And, I really applaud the work done within the Genomic Medicine Service here, set on that infrastructure from the 100,000 Genome Project, which is now, the vision was there and it's now paved the way that these technologies are at our fingertips in the clinic. And we're importantly seeing patients benefit.
What have been some of the challenges to the development, the deployment, the rollout?
Lots of challenges. And we face these challenges with education. I think genomics still, even in the year 2024, it's although people are learning about it, it's not top of the curriculum in schools, for example, in universities, even at medical school. It's not top on the curriculum. And what we're really trying to do is within the health service to mainstream genomics. So to make it this is because it's completely revolutionising how we're treating patients. I often ask medical students when they come through, how much genomics education have you had? I'm always surprised that it's minimal. And really, from day one, as starting as a clinician, you get genomic test results back on day one. And so what we're really trying to drive forward, as well as the patient benefit, the research, is education for everyone. So not just clinicians and nurses and health practitioners, but for the general and wider public, and making it more accessible. So making genomics accessible to everyone. And that's a real passion of mine. And, I think we're really starting to do a good job of that.
Let's get deeper into this education bit. Do you mean for clinicians to be able to read genomic results and apply them better, for individuals to read them and not be afraid of them? What does it mean to have the level of education that
I think exactly that. I think a general awareness for the public that these tests are out there, because I think, I'd imagine if you asked 100 people on the street, they wouldn't realize that, they were eligible if they had an illness for certain genomic testing and what would that mean. And then I think you touched on it exactly right. So one of the hardest things in rolling out these new technologies has been acceptance by clinicians. And some of that comes from, if you don't understand the tests and you get these big results back, what are you supposed to do with them? So there was certainly an element of almost fear of the knowledge of what am I going to do with this information. And again, how we've really combated that is we've put together incredibly good multidisciplinary teams. So when we're analysing and looking at results, it's not one individual person looking at that often. It's been a combination of experts. So you have to be clear that if you're going to get a result back, you're going to know what to do with it. And if you don't know what to do with it, who to ask. So we've really worked hard on empowering patients and staff And we are starting to see the benefits of that.
Is there a certain pitch you make to the public? Some people are afraid to know about their predisposition, but you're describing a slightly different approach where they've already recognized they have an issue, and perhaps knowing more about their genome would help them treat it better. That's not something even in the public that we haven't been told that story.
Yeah.
Why do you think that is? Is that warm or high? Is that the bullseye of what we need to do better, or there's something else?
I mean, I think there is always apprehension about, some people will never want to know what potentially you're at risk of getting. But I think because we work in pediatric cancer, the focus is very much on doing everything for that child. And the first question parents always ask is, why has this happened? And so if you can answer that for them, often we don't know, even with the whole genome sequence, but we can reliably say, look, your child doesn't have an underlying predisposition to cancer. This is one of the, it's incredibly bad luck, but there's no predisposition. And then the second question that's always asked is, what about my other children? What about the future children? And, we can, with confidence of what we know now, say there is no underlying predisposition in your family. And that gives a lot of comfort when you speak to families. So in the patients that I treat, there's not been much apprehension at all about undertaking whole genome sequencing. I think you're right, though, in the adult patients and in other patient groups, there may be some apprehension around looking into your germline. What am I predisposed to? But just to be clear as well, we're very focused when we're doing cancer diagnostics, and we're only looking for cancer predispositions. We're not looking for, polygenic risk scores of your risk of developing heart disease or things like that. We are truly focused on cancer.
For that percent of cancer patients, pediatric cancer patients who've seen their course of treatment change as a result of whole genome sequencing, what specifically has been influenced? What specifically has changed in their treatment? And do you see that expanding as the technology advances?
So over the last 10 years, we've certainly seen there's many tumours where we'd never find the genetic driver in them. And what we're saying, nearly in every patient now where we previously couldn't find the genetic driver for their leukemia, we're finding a genetic cause through whole genome sequencing or another advanced sequencing technology. And so that really, as a clinician, it allows you to...
the genome of the tumour itself?
Exactly, the tumour itself.
Genome of the patient. Okay.
Yeah, so when we look at the genome of the tumour itself, we find these drivers of the tumour. So that gives, as a clinician, it gives you comfort that you're definitely treating the right disease, because I'm sure over the last 20, 30 years, people have been treated for one thing. And in fact, on a molecular basis, they had a different thing. And then it allows you, it often gives you an extra target so you can track diseases, because you can use these genetic mutations then to track, to guide, to say, you're in remission. We cannot find this molecular aberration anywhere in your body at the moment. You're truly in remission. And, the ultimate thing, as you said there, is when a patient management has been completely changed. And I give a very good example. One of the diseases we treat is called acute myeloid leukemia, which has a cure rate of about 50 to 60%, which again, we're always trying to improve that. But there's a specific subtype of acute myeloid leukemia called acute promyelocytic leukemia, which is incredibly rare, but carries a unique genetic change, which has a specific target, which is a non-chemotherapy based regime. And from then, nearly every week we had a win from one of these technologies, albeit whole genome sequencing or one of the other advanced genomic diagnostics like DNA panels or RNA fusion panels, to the point where, each week we'd be waiting, here's another win, and it really is making a massive difference.
I'm so happy for that child.
Yeah.
I mean, nothing brings the technology to life like what you're telling us. We've done a lot of episodes talking about technology and even about how certain disease areas are somehow finding it easier to work with these technologies, but nothing brings it to life like what you're telling us.
And we have there's many examples. So, I mean, that's a real kind of big hitter, but there is lots of smaller wins within that which are equally as important. If we're able, the beauty of being able to find the genetic cause for that's driving the tumor is you can risk stratify patients. So, sometimes we have to give more chemotherapy than we want to because we just don't know what was driving the cancer, for example. But if we know that and we can accurately define that based on our last 40 years of experience, then being able to reduce therapy, I think, is incredibly important. And I think as these technologies get better, that's where we're heading to now. We've spent years and years just increasing intensities of chemotherapies. But now what we really need to do is find targeted therapies to reduce the burden of toxicity for our patients.
Is it for adults roughly as it is for children? Is this the same revolution across the field in terms of age group?
So there is similar findings in the adult population. There hasn't been the uptake so far of whole genome sequencing because of some, logistically is challenging, as you require both a sample of the cancer and a underlying germline sample. But again, as technology is improving, and this year we're going to see a new iteration of the pipelines produced by Genomics England, we'll be able to send tumor-only whole genome sequencing, and it's anticipated then that more adults will be have this test performed, and they'll also reap some of the benefits of this.
How does this approach contribute to the democratization of access to advanced diagnostics and personalized medicine?
Yeah, that's always been the key message, and it's something I'm very passionate about. It's about equity of access. So if I just take a step back, and with the formation of the Genomic Medicine Service, what happened was we essentially consolidated genomic services around the country into 7 locations in England. So it doesn't matter where you're diagnosed, you would have access to those technologies. So it's no longer just, the big academic centres in central London. The person, in any other town across the country would have that same access. And that's something that we've worked on really hard. And again, that drives forward, that education is at the heart of this, because there's a lot of upskilling of clinical staff and allied health professionals, and also, like I said, again, the education for patients, and empowering the patients with the ability to be able to ask those questions. Am I eligible for whole genome sequencing? What does this mean? Is there a genetic cause for my tumor? And so it's about spreading that message across the country. And I think, again, we've done a very good job of providing equity of access. And I think that's a real key message from this whole service.
Public engagement is just a completely different animal when it comes to public health and emerging technologies. It's just such a very delicate conversation. So how do you talk about and really elucidate how to ensure ethical, responsible use of genomic data in general and in the context of pediatric cancer care? What are the considerations and what are the action items, particularly in the UK, where you have a government-wide NHS approach to this? How do you have that conversation? What do you say is the thing we do about ensuring ethical, responsible, well-regulated use of this stuff?
Yeah, and that's something that in the implementation of this, there's an incredibly large amount of work done on this. Because as we've mentioned before, it's, what you need to be sure you're going to be able to, when you get the information about that, you're going to be able to handle that information, and what there's going to be an answer for the patient or the family, and then you're going to be able to offer that patient services required. And we spent a lot of time with the ethical issues around this, and a lot of work done by many people around the country to produce, guidelines essentially for how we discuss whole genome sequencing, in particular with patients. But it's not just whole genome sequencing that this is all any patient really having a genetic test should have counselling for the family, because when you're doing a genomic test, yes, you are testing that child or patient, but indirectly it's a test of the whole family. So the things we discuss with them are, 1, what's the implication for your child? 2, but what potentially would be the wider implications for the rest of the family if we were to find something. And then the key point then is, when we've done all the diagnostics we need, then what happens to that data? So in the UK, we have something called the National Genomic Research Library, which all patients are offered the ability to have their genome anonymously placed into that. So then there is access for the wider research community, not just in the UK, but across the world. And it's very interesting when you talk with families about this, and a lot of families drove actually the desire for that to happen, because people who come and say, well, what have you actually done with, you've done all these tests, but they want to see benefit for other people who go after them. It's amazing to see the altruism shown by many of the families in wanting better treatments for the next child that comes along. So yeah, it's very tightly regulated, obviously, the National Genomic Research Library, but it's becoming and will become an incredible resource to look for patterns in disease. And this isn't just to cancer, obviously. This can be then extrapolated to all the other diseases for which all these tests are available.
How is the development and the incorporation of whole genome sequencing encouraged/forced interdisciplinary collaboration among healthcare professionals? You mentioned clinicians and frontline health workers, but just also in the field of research, practice, application, what sort of community and what sort of interdisciplinary collaboration has come about as a result?
Yeah, I think it's given loads of opportunities, and the data generated from not just whole genome sequencing, but all the other advanced sequencing technologies is producing, massive benefits for both the clinical community and the research community. And, in the whole genome sequencing studies that we've been performing, we've been hand in hand with research, and to see those two things come together has been absolutely amazing. And we'll see more of that. So, a very good example at Great Ormond Street Hospital for Children is our Zayed Research Centre, which is, I think, probably well pioneering that it's the clinic actually sits within the research centre itself. So patients will get to interact with researchers and researchers interact with patients. So it really does drive then because previously people were very siloed. Researchers would not have access to see their patients. That this is benefiting. And what we've really tried to do at Great Ormond Street is get those things completely merged. So nearly in every aspect of our diagnostic lab, there's some kind of interaction for the scientists who are performing lots of the tests to interact with both clinicians, clinical meetings, but also interact with patients. And I think it's starting to produce a incredibly great working relationship. And the involvement of patients and the public is increasingly important in everything we do in terms of driving research, driving new treatments. So I think it's been one of the fundamental things to do to try and merge all of those together.
That one intersection is a very big deal. I can imagine a lot of observational value for those researchers in the clinical setting, new hypotheses, what comes out of that rather than me guessing at it.
It's amazing. So, I feel incredibly lucky that I sit my office is next door to all the scientists in the laboratory, and that it's really fostered an amazing academic and clinical output for our patients and improving things. Give an example, you can just be making a coffee and having a chat about something, which then leads to a project, which then leads to a paper, which then has ramifications. And so I feel incredibly lucky that. And I enjoy going in every day because you get to interact with people, with the scientists and who are doing, most of the actual kind of diagnostic work. And, many places, like I said, work slightly siloed from that. And you definitely do miss that connection. And I think we all saw that during the pandemic. Although Zoom and Teams, it's opened up a global world. That interaction with people to discuss projects or research findings, it's really key.
There's a lot of ideation that I imagine the clinic as campus, but also in my own reporting life as a journalist, when I've spoken to scientific researchers, medical researchers, they ask me to go fetch what are the patients experiencing. Can you tell us what the patients are saying? And so this is a massive opportunity to close that gap. It's very, very interesting.
Yeah.
Where do you see this going, both in the realm of pediatric oncology and beyond? You've seen it now up close. I'm not asking you to predict the future, but if you track, how you've experienced this, where is whole genome sequencing going to change medicine as we know it?
Yeah, I think it's already doing that. And when I reflect on the 12 years since implementation, that's an incredibly fast how the technology was first really available, on a reliable basis, to now we have it fully integrated in our healthcare system. I think it's going to be key, and nearly in every every disease that's treated, not just cancer. I think, there's going to be advances in how we analyze the genome, and, it's going to give us answers to many questions, all the way through from personalizing medicine to pharmacogenomics, to predisposition. And it's key. And again, which is why my plea is always about education, and really trying to mainstream genomics into, it's a normal conversation. And, it should begin now really at school, I think, and all the way through school into university, into jobs. Because, the access is there for everyone. Even, you can, if you go online, you can just find a place to send off your whole genome if you want, and you can get answers back like that. So there's commercially available. So I think, the public need to be aware of this, and I think they are. And the more we can educate both public and other healthcare providers, the better we're going to get at this. And with the overall benefit of, producing good outcomes for patients.
I hope other disease areas are going to experience what you've experienced. I don't know that it's been quite as universally applied across fields, but this sounds like an amazing frontier.
Yeah, some of the rarer diseases, there's been, real big wins from whole genome sequencing, because there's always patients where you just never know what's causing their constellation of symptoms or signs. And to be able to give a family, a diagnosis finally after, when you speak in the rare disease, we speak in the rare disease setting to patients and their families, sometimes they would have been chasing the diagnosis for 10, 15 years. And to have an actual kind of label for that is, you can't underestimate the importance of that. To then you can start then looking, for groups of other people who have the same thing, from across the world. And, we live in a global world now, and it's, so we can share findings really quickly. So I think we're going to see, not only in cancer, but in rare diseases, and then in some of the more common diseases that are around, we're going to see benefits for sure from whole genome sequencing.
You get to see, drive, and experience progress more than many people in your field. But I still have to ask you this question we've been posing to all of our guests. What do you think is the biggest challenge facing the future of healthcare?
Yeah, I think it's a very good question. It's I guess how we manage all this information, because definitely the technology is improving, and the analysis is getting better faster than we know how to implement it. And I think it's going to redefine how we, plan things like clinical trials. For example, in cancer, most patients are treated on what's known as a clinical trial, and you may take 2 or 3 years to plan that. But by the time you've planned it, the technology's moved on. And especially with genomics, we're seeing that we're starting to, you're finding new targets all the time. So I think, how we're going to have to be, have to pivot in how we're designing clinical trials for patients, how we're delivering medicines to patients. And again, coming back, the theme, I think, of this talk has been education, really. That's going to have to be key to this, because the technology is developing incredibly quickly. And then how we can store, analyze, use this data for good is going to be the real challenge.
Abu Dhabi Global Healthcare Week is coming up. What are you most excited about?
I think I'm excited for that the face-to-face interaction with people from all over the world. I said, it's a global world we live in, and it's going to be amazing to talk to people in Abu Dhabi, and it's impressive to see the Emirati Genome Project, and that's a very exciting project. Very ambitious, million Emirati genomes. So to interact with people will be amazing. And as you know, Great Ormond Street Hospital for Children, it's an international hospital. It's an international hospital for research. And we have many key relationships with countries in the Middle East. So it'd be really amazing to connect with some of the scientists and people working on the floor there, really. So, yeah. I think the interaction with people and getting new ideas, seeing how things are done slightly differently, seeing what we can learn from each other, shared practice. And again, back to my theme of education, I think, meeting people, talking about these things, what can we learn from each other? What can we learn from, in the UK about the Emirati genome? What can people in Abu Dhabi learn about what's happened in London? And I think working together, it's going to be amazing.
Well, we are very excited to see you back in the UAE. Dr. Jack Bartram, thank you so much for joining us.
Thank you very much for the opportunity.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.